Dear Capital, what programs do you provide to promote and protect the status quo of our health? You see, we've all got scrapes and scars among your buildings. Wishing to be skyscrapers, in your cars are keeping us congested with costs caused by jammed causeways, causing capital release of toxins mixed with burning scents of tobacco and weed. These burning scents are clouding more than our senses. We are desensitized to flashing lights and medical emergencies, where the urgency for change is dulled by the lack of change in our pockets. And so many find they are unwilling to donate their time and their energies, providing them with the time and their energies to complain of no change. Like gray clouds in our days, we are dazed. Because despite the fact that 3/4 of adults aged 25 to 64 have post-secondary education, many face economic vulnerabilities according to their situation. And those of us aged 65 and up, in our faces, we are faced with high blood pressure, heart disease, arthritis, back injuries, and diabetes, which are the most chronic cases. So, what programs do you provide to promote and protect the status quo of our health? Dear Capital, we are fogged. Because lessons to our senses desensitize us, the more it dulls to dull news. Like decreased learning through lessons now censored, lessened by less intense curriculums in school systems. But we at least are very happy and very enthused that your schools are filled with more diversity on average, because you're allowing more diverse cultures to move in at a national average. 1 in every 4. A minority that is visible. Though we strive for unity in communities, we are not yet a city indivisible. Check your visible stats. 4,600 reported cases of infectious diseases in last year alone, but the unreported and hidden in our homes, those cases of us that have been infected by prejudice and preconceived ideas based on our covers. Yet beyond OHIP, not all of us are covered. 12% classified by low income, meaning we receive a low income of opinion from all others. But what of our entirety? About 1/4 of our households spend 1/3 of our household incomes on shelter alone. How much more difficult for those living alone, unsheltered by shelters, living in single units on their own. And when it comes to the basic cost of living, Ontario Works may have 7% of us covered, but it doesn't cover the cost to feed positive, healthy, nutritional needs to these our families. This unhealthy eating a risk factor for disease. And if these are not just learned lessons from our senses, then just take a look at your census. It costs $789 per month to feed a family of 4. But what of us who are economically poor? What are we to do? What unhealthy eating can only motivate us less? Those of us strong, are we left to pick up the rest? Burning tens of twenties of dollars of bills instead of burning what we should, our calories, and filling our chlorophylls with a minimal production of ATPs, our inner energies. Adenosine triphosphate, where our fates are factored into our weakness of weekends, where we end our weeks with weak physical activities or lack thereof, sending our hearts and our minds to the hospital's package in care of. We are just hurting ourselves, literally hurting ourselves. Look at 2012, 1,200 in 1 year, hospital emergencies, and all due to our own self-inflicted injuries. Now we know that the state of our wealth does not dictate the state of our health, but we know that just a little bit of help does in fact help. So what programs do you provide to promote and protect the status quo of our health, dear Capital? Despite the fact that we have high cholesterol, heart rates, or blood pressure, we also have high hopes, for we know that over half of our residents claim their health as excellent or very good, which is good. But on the flip, chronic conditions and injuries are affecting our blanket health and well-being. So we respond with blankety blank blank on our breath left in our vocals. And the risk of infectious diseases continues to be a public health concern for our locals. So let us control these outbreaks with public provisional vaccine, so we could rise to the occasions and rise up our energies and rise higher our spirits, rise higher than any our mezzanines. So continue to make room and provide space for us, to help us with programs that you provide to promote and protect the status quo of our health. Dear Capital?